So welcome all to this morning's webinar on the test and trace system and talking about some of the key prevention measures we should all be taking at the moment. So I'm Emily van der Venter, I'm Associate Director of Public Health for Warwickshire County Council and South Warwickshire CCG. Very pleased to have a few colleagues from the district and our Stratford district and Warwick district and Warwickshire County Council with me today to help field the questions that we've had submitted. So if we start with, we've got our councillor colleague, so Councillor Les Caborn is with us from County Council.
Yes, good morning everybody. Les Caborn, I'm Cabinet Member for Health and Adult Social Care and Chair of the Health and Wellbeing Board, and our lead member for Test and Trace.
Thanks, Les. And Councillor Joe Barker.
I'm Councillor Joe Barker. I'm here on behalf of Stratford District Council. I am also a county councillor, and I'm the portfolio holder for health and wellbeing, and I do test and trace too.
Thank you, Joe. And Councillor Judy Phelps is also with us.
Good morning, everybody. Councillor Judy Phelps, Warwick District Council. I'm the portfolio holder for Health and Community Protection. Like Joe, I'm also a county councillor and a town councillor. And yes, I'm involved in test and trace as well.
Thanks, Judy. And if I get to Liz Young from Warwick District.
Morning, everyone. Yes, Liz Young, Warwick District Council. I'm Community Safety and Partnerships Manager based in Health and Community Protection.
Thanks, Liz. And I haven't seen a pop up on the screen, but I believe we've got Abby from Stratford District with us this morning.
Hi, yes, I'm here. Environmental Health Officer at Stratford District Council.
Thanks, Abby. Good to have you. We've also got Jeremy Vaines from Citizens Advice to help with some questions today too.
Yes, my name's Jeremy Vaines. I'm the Chief Executive of the South Warwickshire Citizens Advice Service. I'm not a fully practicing advice worker, so if there are some really convoluted questions, I will get them researched and circulate them later, but I'm very happy to help with the general way of things at the moment. Thank you.
Great, thank you, Jeremy. And finally, I wanted to give thanks to my colleagues from the localities team within Warwickshire County Council. So Barty, who you'll have all had an invite to, has organised this today, and Alistair and Amanda have been supporting with the organisation. And Alistair, I believe you're also going to take a section of the presentation when we come to it.
I think that's Amanda today. I can
Apologies.
sit on the panel if you'd like me to.
Thank you. Sorry, Amanda.
That's okay.
Introduce yourself.
We like to move things around.
Do you want to just introduce yourself, Amanda?
Sorry, Emily. So Amanda Wilson-Patterson, I'm the Localities and Communities Officer for the Stratford District.
Brilliant, thank you. Teamwork from Alistair and Amanda. So I will start with the presentation, then as I say, we will move on to questions. We'll just share my screen. Hopefully this works for you all. So I can see Amanda, if you can just give me a nod if that presentation is loaded up. Yeah, great. So as I say, we're going to talk today a little bit about the Test and Trace programme, what it is, how it works, and how we can all work together to really get on top of the coronavirus pandemic. So I've spoken about the agenda, and just a reminder to colleagues, if you're not on the panel, please turn your video and your microphones off to help save bandwidth. So we'll cover a little bit initially around what there is in terms of supporting communities and the ongoing support that's available, give you a little picture of the prevalence of coronavirus that we've seen in Warwickshire to date and the pattern that we're seeing there, some of the prevention measures, and then we'll go on to talk about test and trace in more detail, and then information around how we can all work together to help each other. So I'll go to Amanda at this point.
Great, thank you, Emily. So this is really just to say a massive thank you to those pop-up groups that obviously mobilised themselves during the pandemic, or at the start of the pandemic. There was 304 pop-up groups and existing groups who adapted their offer to support communities across Warwickshire. I've broken this down obviously in terms of district and boroughs. So 74 of these groups were in the north, so that was Nuneaton and Bedworth and North Warwickshire, 56 in Rugby, and obviously not surprisingly in the south with Warwick and Stratford district there was 174. So all of these groups formed part of the COVID-19 Community Support Directory, which was set up to respond to the pandemic and support communities. And as I said before, mobilisation of these groups has been amazing. And the directory can, at the moment, be used as a networking tool to keep in touch with each other. And there below is a link for the directory. And obviously also groups came forward in terms of numerous requests for help directly, and these came directly from residents and via the council's shielding helpline. So we're sort of here really to be the point of contact when it comes to supporting the post-COVID-19. And that's really around things like volunteering opportunities, because obviously as the pandemic obviously eases, obviously there'll be those people that have come through for volunteering. And obviously we would like to keep those volunteers as much as we can. Funding to support those groups that have come forward in terms of creating a legacy. And obviously, you know, in terms of COVID-19, any network groups and helping those with test and trace and later stages, obviously, of the pandemic. And obviously, as much as we are, there's myself and Alistair actually here today, we do have localities and communities officers across the county, and I've detailed all of their contact details there. And myself, Alistair, and Laurie Harvey, we're actually covering for maternity leave for the LACO in the Rugby post. So it was really just to say a massive thank you to all of those groups, and just to add really onto that there will be a mutual aids community support group that we're organising in partnership with Carver. Carver are taking the lead on the 28th of July between 10 and 11:30 a.m. and hopefully most of the groups would have already received an invite to that webinar. Thank you.
I muted myself. Thank you, Amanda. So before we went any further, we just wanted to say a massive thank you to all of you that have been out there supporting in whatever way you've been helping during the pandemic. So whether you've been working in a public sector organisation, part of a voluntary and community sector organisation, or just in the community helping your neighbours, a massive, massive thank you. The hit on the NHS from the initial peak wasn't as bad as expected, but it was incredibly helpful to have to know that we had people within the community that were able to support people who were vulnerable, to help prevent risk of infection to themselves, but also helping those when they were discharged from hospital with some of those practical tasks to help them settle in back home. So we couldn't have done it without you, and we continue to need your help. So again, thank you, everybody. So the picture of cases in Warwickshire is in front of you now. So this is kind of a couple of days old now, but you can see we had this initial peak and it's been coming down quite steadily now and really tapering off now. So we are seeing a few cases still occurring, which isn't unexpected. It seems to be becoming under control, which is really encouraging. But obviously, we still need to work together and really support the test and trace system to really knock this on its head and hopefully prevent a second wave. If we do get a second wave, test and trace is absolutely key in helping to mitigate against that, causing too much of an impact on our local communities. So in terms of the key prevention messages and activities we should all be following, this hasn't changed really throughout the pandemic, and these measures remain vital. So staying alert to symptoms, so a new continuous cough, a high fever, or a change in taste or sense of smell. That change in taste or sense of smell can be quite an early warning. So I have to say I've got a little strawberry flavoured putty, which my little boy happens to have, and every now and then I have a little sniff just to be sure. Also, if you can please remain vigilant around hand washing and help to get those messages out. That's still a really, really important factor. So soap and water is always the preferred method if possible. If you haven't got access at that moment to running water or soap, then to use hand sanitizer of an alcohol volume of at least 70%. So I've just seen in the comments some people are struggling to access the presentation. So Barty, I've just sent you a copy and could potentially circulate around attendees now, just so those that are listening and are struggling to view it can see it through their email. Face coverings are important, so hopefully you'll be aware that they've been mandatory on buses for some time, and come the 24th, so come Friday, it will be mandatory to wear them in supermarkets and shops. Also, not mandatory, but encouraged. We would encourage people to wear them in enclosed public spaces. So if you're indoors in an environment coming across people you wouldn't normally meet, and where social distancing might be difficult, then a face covering can help to reduce the risk of transmission to others. And we do know that some people are asymptomatic, so may be carrying the virus but unaware of it. So, you know, you could have the virus and not be aware. So if you're wearing a face covering, that will prevent the risk of any transmission from yourself to others. So really important in terms of preventing the spread and protecting vulnerable individuals. And the catch it, bin it, kill it poster, I hope will be a familiar image and message to many of you. It's a campaign that tends to come out at flu season, and it's been around for a number of years. So that is if you are going to cough and sneeze, to use a tissue if available. If you haven't got one to hand, then please cough into your elbow rather than into your hands. Bin any tissues and kill the virus by washing your hands after any coughing or sneezing. Also think about if you're in a public space, or you may have just coughed onto your hands, do you need to just wipe down any surfaces that you might have touched before getting to hand washing? So on to test and trace. So this is the new term really for a system that's been around for a little while, although has obviously recently scaled up quite significantly. So this is our contact tracing system. It's absolutely vital in controlling the spread of any infectious disease, but obviously particularly at the moment around coronavirus. So following identification of a disease in an individual, we do our very best to try and understand where that individual may have picked the virus up from, and to identify people that they have had contact with in their infectious period, so we can warn those contacts, ask them to isolate, hopefully before the beginning of any infectious period if they have picked up the virus based on that close contact. So we would risk assess all close contacts and give them advice around isolating and being alert to symptoms. I'll come on to the next steps later. And in terms of any settings like workplaces or schools, we also look at what prevention measures have already been put in place, and most of our settings have been very compliant with that, but also just exploring a little bit more in depth around whether there are any additional prevention measures that they should put in place to reduce the risk of any future incidents. So this is hopefully an image that people will begin to get familiar with. This is the government's depiction of the test and trace system. So I'll start on the blue side of the screen. So if you have any coronavirus symptoms, so to high temperature, a new continuous cough or change in taste or smell, then please start isolating as soon as you can. You'd be required to isolate for 7 days, and that really does mean not leaving the house at all, if at all possible. So finding people that can help you to get shopping or essential supplies in. So you would be asked to isolate for 7 days. And additionally, any people that you live with in your household would be asked to isolate for 14 days. So this is due to the incubation period potentially running up to 14 days. So it just gives that time for your contacts to run through that incubation period, so we can be sure as to whether or not they have contracted the virus. So as well as isolating, you would be asked to book a test as soon as possible, or you'll be required to. So you can book a test through nhs.uk/coronavirus, or calling 119 if you haven't got access to the internet. Options for having a test include having a postal test kit sent to you, or going to one of our drive-through testing units. I would advise, if at all possible, to try and get to a testing unit, because the turnaround of tests is a lot quicker through that system, so they will get results back to you within 24 hours. Postal obviously takes a bit longer in terms of getting the test to you, so you should get it within a day or two. And then if you can take it, post it back through, you'll start seeing some post boxes have got priority post box labelled on them. Send it back through one of those post boxes, and you would get your result back, they say, within 5 days, hopefully sooner, but in terms of the demand on that service, they do need to say to warn it could be 5 days. So you can see why going to a testing centre is advised. So if you come back with a negative result, you would be asked, your household contacts can stop isolating. You would be advised to only go back to work if you are well and your symptoms have subsided. So there is a small risk of having a false negative result. Hopefully that is a fairly low risk, but of course you may still be ill with something else. So we don't want to be telling people to go back to work if they've got the flu, for example. So you would need to be well. If you have a positive result, then you will be contacted by the NHS Test and Trace Service and asked to share your close contacts. I'll come on a little bit later to explain what we consider to be a close contact, but for the moment I'll just move across to the yellow slide. So if you are a close contact of somebody who tests positive, you'll be alerted by the NHS Test and Trace Service. You'll then be asked to isolate for 14 days following your last contact. If you develop symptoms, please do book a test using the methods I've already mentioned, so nhs.uk/coronavirus or calling 119. If you book a test and the test comes back negative, your household contacts can stop isolating immediately. However, you still need to complete your 14-day isolation period. And that is because you are still a contact of a confirmed case and you still need to work through that incubation period, just so we can be sure that you haven't contracted the virus. The quality of the test result, the kind of robustness of it, depends where in the incubation cycle you get tested. So that is why we still do ask people to complete the isolation period. If you test positive, then you are now a case. So your isolation period resets to 7 days from when you've had that positive test result back, and your household need to complete the full 14-day isolation period. I can see there's a hand up for a question. Do you want to come in, Lynn? So Lynn, happy to take your question now if you want to unmute yourself and ask the question. Okay, just as I can't hear you, Lynn, so for timeliness, I'm going to carry on through the slides and perhaps you can pop the question in the chat function and we'll come to that at the end. So when the contact tracing service contacts you, these are the points they'll be looking to ascertain. So they will be asking, obviously, whether you've got any family or household members living with you so that they can be advised to isolate for the 14-day period. And then they'll explore whether you've had any close contacts with anyone since your symptoms started, obviously when you're infectious, but also in the 2 days, the 48 hours before your symptoms began, because you can potentially be infectious to others in that period. So in terms of that infectious period, they'll be looking at places you've potentially visited. That could be pubs, restaurants, cafes, shops, GP surgeries, and particularly interested in kind of GP or healthcare settings. Obviously, you may have been in contact with some vulnerable people in those settings, schools, etc. So they'll explore your kind of travel movements in that period. And where you can, you'll be asked to provide contact details for those contacts. Obviously, there's a chance that some of your contacts you may not know if it's contacts within a bar or a restaurant, for example. And that is why when you go to those places, they are asking people to provide their contact details. That's kind of voluntary, but we would strongly encourage and ask people to provide those details when required, when asked. It means that if we do have any cases, we can obviously act really quickly to contact those contacts and ask them to isolate. So in terms of what we mean by a close contact, and the three definitions there, so face-to-face contact with somebody less than a metre away, that's kind of within a minute or for any period of time, really, face to face, within a metre. If you're within 1 to 2 metres, it's looking at a 15-minute period, because kind of length of exposure matters, as well as just kind of a one-off period. So less than 2 metres, or whether you're travelling in a car or other small vehicle with somebody, they would be considered close contacts. So there's some nuances between the 1 metre and the 2 metre, but broadly speaking, if it's any contacts within 2 metres, we're likely to be wanting to speak to those contacts. So if you're asked to isolate, obviously this can have an impact on employees and maybe concerns around loss of income. So your employers must be supporting you to isolate. So if you're a case, you're obviously entitled to sick pay, and hopefully that's fairly straightforward to understand. If you're a close contact and you've been asked to isolate for 2 weeks, your employer may ask you to work from home where that's reasonable and practical. If it's not possible, then you are entitled to sick pay for the 2-week period. I'm sure Jeremy can touch on this a little further when we get to the questions, but there's some links to some helpful guidance around eligibility for sick pay there. So this then a request for help really from everybody on the call today, and for you to share these messages within your communities. So the first key point is to please share contact details when you're visiting public places. And as I say, some settings like restaurants, that might feel quite normal to do if you were making a booking. It may feel a little bit different in some other settings, but please do comply with that. It's a really big help. Social media can obviously be a really powerful tool for connecting with people, and we've seen its value and I think increased use during the pandemic period. But of course, it can also be a risk around spreading misinformation. So I've put a couple of hashtags there. So if you were to search on social media for Warwickshire and those hashtags, you'll see the posts that we're putting out there from Warwickshire County Council, and we would really value your support in helping to distribute those more widely on social media. So please do tag and forward on our posts. There's also a link there to additional resources that are available. So coronavirusresources.phe.gov.uk, and there's a whole wealth of images and posters available about test and trace, about looking out for each other, others' mental health, about what the symptoms are. So if you're keen, please do have a look there, explore and consider sharing some of those resources within your community, perhaps printing off some posters and popping them up in local shops, etc. In terms of supporting each other as well, we recognise that many people on this call will have been supporting people who have been shielding and isolating for that purpose. Obviously, we're going to have more people who are asked to isolate for a short-term period through the test and trace system, and some of those may need help to get shopping or essential items. So please do continue to look out for and support your neighbours and members of your local community. People who have been shielding, formally the shielding period ends at the end of this month and people are no longer required to shield. However, that doesn't mean that people will necessarily feel very comfortable going out there after having had a period of being told to, be really careful and not leave their house as much as possible. So just a request really for those of you that have been working with people who are shielding to continue to support them as much as they need. Some of that may be about starting to encourage them to come out in a safe way and in a way that helps to reduce their anxiety. So perhaps some short walks with people or helping to take people to the shops. I've certainly felt quite comfortable within certainly my local supermarket. People are pretty good with social distancing and wearing face coverings. And for some people who haven't been in those environments at all, I think, the first visit to one of those environments where it's an activity that used to be very normal and now feels quite different can be quite anxiety promoting. So I think even just sharing a bit of information with people around how kind of the flow of people through supermarkets, etc., is being managed may help to reassure individuals and help them to feel more comfortable about going out. And I've put in, please look out for each other. So this is not just around looking out for symptoms around coronavirus and helping to support isolation, but also supporting people's mental health and well-being. So this pandemic period has been completely unprecedented and has presented different challenges to all of us in terms of our mental health. We will all be dealing with different challenges and coping in different ways, but no doubt we will all have been affected in some way. So, and ask really to look out for people to try to be open to talking about mental health and well-being, sharing that message that it's okay not to be okay, it's quite normal to struggle at this time, and really to help open up a conversation. So do ask people how they're coping. We recommend asking twice because we often, the first answer is often that automatic, yes, I'm fine, thank you. But to give a follow-up question can really help to open up that discussion, and getting people to talk about some of the challenges that they're facing or ways in which they're struggling can be a real lifeline and hopefully prevent initial difficulties kind of escalating into anything more serious. Finally, I've put a link there to the Warwickshire Police website. So they've got an online form where you can report any concerns about breaches of coronavirus measures. You can also obviously contact the police using 111. The guidance has been changing, but what is consistent is that any events or workplaces need to be putting in what is called COVID secure measures. So we'll talk a little bit more about some of that. I know it'll come through from some of the pre-submitted questions. But I think if you have any concerns, perhaps about a workplace or an employer that's not supporting people to isolate, or that's not supporting to be or putting adequate prevention measures in place around social distancing and other mitigating measures, please do let us know. So the police have got powers to act. They also have strong links with regulatory services, environmental health officers and public health colleagues. Just noticing, yes, thank you. In terms of reporting to the police, you can do that via 101, not 111, which is the NHS helpline number. So thank you. So that was it in terms of the key points I wanted to make initially. So I will go to our pre-submitted questions now, bringing in some of our panel members. I think the first couple of ones I will take myself. So the first is how and when do I get tested, and when do I get the results back? So hopefully that was covered, but just as a reminder, requests for tests can be made via nhs.uk/coronavirus or calling 119. If you go through the website, there's a few questions to ask, and then it will bring up a list of options in terms of where the testing units are currently located and where you can go to get a drive-through test. And as I say, the results are much quicker, so within 24 hours from one of those testing units compared to a postal test. Question on, can I go to my GP with COVID-19 symptoms? And I would just really plead that you don't just turn up at any healthcare setting with symptoms, but make sure you phone in advance. So you can, of course, talk to your GP about any concerns you have around COVID symptoms or other symptoms. And if they do have concerns that you have COVID and they still want to see you face to face, they can do that in a safe and managed way, but they need to know that you're coming first. So they've got kind of sections set up within hospital and within GP surgeries for dealing with people with COVID symptoms, and for those that haven't, so we can keep them separate. Just on that point, I'd like to also raise, please don't delay going to a health setting if you have any other health concerns. So we have seen quite a significant reduction in terms of people turning up at A&E or GP practices for other reasons, and a reduction in people attending cancer screening appointments, for example. Please don't delay. As I say, healthcare environments are being managed very safely at the moment, so they are okay to attend. And if you have any concerns, just phone up in advance. A colleague from South Warwickshire Foundation Trust recently said to me she feels a lot safer in the hospital than in her local supermarket at the moment. So just to make that point around, you know, how well they are controlling those environments. So I think that's enough from me for a moment, and I will go to colleagues with some of the other questions. So firstly to Abby. So there's a question which I think requires an environmental health response around what are employers expected to do to reduce the risk of infection within the workplace, and also to help with test and trace.
Okay, there's some really good guidance for each business on the government website. It's quite sort of sector specific. So that's where we'd initially guide businesses to look. The main factor of that is to actually produce a COVID-19 risk assessment, which tells us and sort of to get them to go through the mindset of how to actually control the risks in the workplace of preventing the spread of coronavirus. So that's the main requirement for that. The main features of that risk assessment will be information to the public and to employees, promoting good hygiene, social distancing measures, obviously, and also, if required, PPE screening, etc. So they also, any sort of public-facing businesses that can do should really try and retain customer records for a period of 21 days. That can just be sort of a name and a number or an email address. It doesn't have to be too sort of intrusive or too sensitive information. But that will also help with the sort of test and trace system should there be any cases, any confirmed COVID-19 cases in that workplace. So we're actually helping businesses to comply with the regulations and with the guidance. We're answering quite a lot of queries and also dealing with complaints as well. Unfortunately, we do have some complaints from customers or employees who are sort of concerned about their workplaces. So we will follow every complaint up that comes in. Okay.
Thank you, Abby. That's really helpful and really reassuring, obviously, that you're following up on any concerns that are raised from communities. And obviously from 1st of August, employers have got more discretion to ask people to come back to work. So thinking kind of office settings where people have been working from home. So you may expect to see changes within your work environment if you are going back into a physical setting. But so things like staggered start times and obviously more distancing within the workplace. But as I say, any concerns, do let either environmental health colleagues know or report to the police, and we will follow up on those. So in terms of just following the employer theme, I was going to come to Jeremy next with a question on what do I do if I have concerns about my employer not supporting me to self-isolate?
Generally speaking, I think our feeling is we are seeing lots of questions at the moment about furlough, about redundancy, about employer tactics, particular questions like that. And I think our suggestion would be, given that we're going to be with COVID and these sort of arrangements for a long period of time, we would guide people to access the online citizens advice, the help sheets. It's a national system. It's extremely responsive. It's updated every day. So case law changes, all of the new sort of local law and crisis law that's come in, all of that is continuously up to date. And it gives you access and will take you through sort of lines of questioning and algorithms to try to answer the current situation. The general issues to do with employers' duties are also well covered by the ACAS website, which is really good in terms of trying to encourage both employers to be up to date and responsive and engaged, but the employees to be, if you like, mutually agreeable to every sort of interpretation and decision. The employees should be able to get hold of risk assessments and the framework of approach that the local employer is taking, their interpretation, as you say, of the sector by sector guidance. If for some reason it's not possible to find the answer on that, then you could access your local citizens advice. And if you go on our website, which is Citizens Advice South Warwickshire, you will see that you could put a question into a Google form, an email, which we will then respond to very quickly. And equally, you could ring a telephone number, which we will take a number of calls each day. There's a backup nationally. So if we don't answer, the national team could well answer and send an email back to us with the triaged question for us to pick up and answer. We will then ring local people back and give them their answers. But on the particular question, the traditional employee-employer relationship, just like landlord-tenant, is stay engaged, be confident, ask questions, and your employer should reasonably respond to your questions now. If we move to another phase of containment or test and trace or a local lockdown, your employer should continuously be able to answer your questions, and if not, you can seek independent advice on whatever the law is at the moment.
Thank you, Jeremy. Really helpful. I think the key message is really to encourage employees to feel empowered to ask those questions and to know that you are backed up by legislation and guidance within the workplace. I understand if you are asked to isolate and you're a temporary worker, so you may be an agency member of staff or on a 0 hours contract, there's still potential for you to be able to access some benefits. And there's, again, information on Citizens Advice website about that. So just to stay on the workplace theme, I just wanted to give a little bit of an overview around what happens if there's an outbreak within a workplace. So workplaces are required to report individual cases, but we would consider it an outbreak if there were 2 or more cases that seem to have an apparent link. So that could be within the workplace. So we will then call what we call an incident management team, which would have representatives from Public Health England, the local public health team, the local district or borough council, normally environmental health officers, and the manager of the workplace. We would obviously be ensuring those measures around isolation are in place, but we'd also be looking at what measures the workplace have put in place around prevention. So have they got the appropriate cleaning products and cleaning processes in place? Have they got appropriate measures around social distancing or other mitigating factors such as screens between people, and also the kind of ventilation within a workplace, how they're managing break times and canteen attendances, making sure people are staggered so there's limited contact, and looking at how they're what we call pairing of work of employees. So if people are working together, that they're kind of in fixed pairs or teams so that there's minimal cross kind of contact between teams. And we will monitor that situation. So some obviously contacts will be asked to isolate. If they come back and test positive, we'll pick up on those positive cases and do further contact tracing, both from a kind of household and community aspect, but also looking again at the workplace potential contacts of those contacts. And ensuring that's all in place. We will then, we only declare an outbreak over after 28 days. So we will continue to have some oversight of the workplace situation for that 28-day period. So that's 2 incubation cycles for the virus. So we can feel confident that the situation is under control. So what I would say, experience to date, is that we've had quite a few individual cases within workplaces. Largely, we haven't seen much transmission within workplaces because employers have been good at getting the prevention measures in place, and hence the number of close contacts is quite limited. Where we have seen a couple of cases within a workplace, some of that seems to have been actually potentially community acquired, and it's just happened to be picked up that they work at the same place. Very small number of cases at the moment where we've identified some transmission within the workplace, and obviously we've put advice and measures in place to reduce that in further. So I wanted to share that, really just to offer that reassurance that the social distancing and the prevention measures are working, and employers are largely complying with those, and very cooperative with any of the investigations that we've had to do to date. So the next question I was going to pose to Liz from Warwick District, and potentially Joe, thought you might want to come in on this one. So this is just to say well, the question is, what happens if I'm asked to isolate for 2 weeks, but I have no food in the house and nobody that can help me?
Thanks, Emily. Well, certainly when the outbreak started, as Amanda touched on at the beginning of the webinar, we had to mobilise extremely quickly. And when I say we, I'm not just talking about the local authorities, but also the voluntary and community sector out there were absolutely amazing in the way they responded so quickly. And in particular, the Warwick and Leamington COVID support groups and the Kenilworth COVID support groups. So, we're now 4 months down the line, and I think we're very fortunate that we've now got some really robust structures in place. We responded in the emergency situation, and we're now into the recovery phase. And I think I could say with a lot of confidence that anybody who has to self-isolate now, there is a wide range of support mechanisms out there. And I can run through just a few now, but I'm sure we can provide the contact details after the webinar, Emily, if people require those details. But just to run through, I mean, initially, obviously, there's the Warwick District Council website that people can contact. We have a local community support directory on that website that people can access. There is also the Warwickshire County Council hotline that's been operational since the outbreak. And also the Warwickshire County Council website, which you can access the Warwickshire Together leaflet online, which shows all the available support services, as well as the Warwickshire-wide community support online directory as well. The Warwick and Leamington and the Kenilworth COVID support groups continue to operate. You can access them on their websites and through their Facebook groups. They've been absolutely invaluable. I was the operational shielding hub manager for Warwick District, and the shielding hub was backed up by the community partnership team for Warwick District, who dealt with all the additional support needs, as well as emergency food that we dealt with at the shielding hub for the clinically extremely vulnerable who had to shield for 12 weeks. There was also so many additional support needs for people, and that could be medicine, just mental health support needs, anything, a whole range of stuff that we had to deal with. And we benefited from the support of those COVID help groups enormously with their wonderful volunteers who would just basically go out and help everybody who had to isolate. It was phenomenal, really, and they are continuing with that work and that support. Also, the online supermarkets continue to give priority slots to those who have to isolate, so it's quite straightforward now to receive shopping online. And if people are located in rural areas, again, their parish councils, we had a lot of parish councils who set up their own COVID support groups. So people who have to isolate in those locations can initially contact their parish council to find out what's available in their immediate area. And also we've got our wonderful community hubs who are now looking to reopen their facilities within current restrictions. So within Warwick District, that's Brunswick Hub, the Sydney Centre, the Patmore Centre, and also facilities within Crown Ward as well. And also the council have got a community economic recovery fund that's available now to community groups to help support people out in the community. And that is a rolling programme of grant funding that groups can access. So that obviously helps to build the capacity of those community groups who are trying to get back on their feet in the community phase, in the recovery phase, to make sure that they can help people. So there's all manner of different ways that people who have to stay at home, if they do test positive, that, you know, quite confident that they'll be able to access the information and support that they need. So.
Brilliant, thank you, Liz. A very thorough answer. I don't know if there's anything you wanted to add there, Joe.
Yeah, there's just a few things I'd like to add. I do want to make the point that it isn't just Warwick and Leamington and Kenilworth that are managing to do this, just so that the rest of the county knows that southern part of the county knows they're covered. Most of the COVID groups that I'm aware of in the small villages are still going. That's if they set up at all and didn't just act as they normally did and help their neighbours. I know that in the main rural centres, the groups are still operating and will pick up prescriptions for people and will still do their shopping. And I take on board Emily's point about being with people to try and encourage them out. I met somebody who had been having cancer treatment before lockdown, and so actually hadn't been out for 6 months. And to say she was wobbly and frightened was an understatement. I've never seen anyone looking quite so wrecked. So I think it's worth remembering that we will have neighbours who possibly need someone to go out with. And I know, I mean, and a couple of the people I'm looking after, I said when they started driving, I said, do you want me to come with you? Because I just thought, you know, octogenarians driving for the first time, it was going to be quite fun. In fact, in Shipston, someone did drive straight into the health centre when they were first unlocked. So that wasn't so good. It took out the wall of the health centre. Just to make the point about the phone numbers, I put the general COVID line on the messaging, and Amanda had put the NHS one, the 408 1447, and they're still operating and really important. I think that people know those, because most of the people that we may be helping and referring on, that will be what they want to know. In terms of the shops that are doing deliveries, Morrison's, Iceland, Tesco, and now Ocado are, and they've opened up quite a lot. One point I would make, because I help run a food bank, is that the Trussell Trust food banks and the non-Trussell Trust food banks will offer to take bags of food round. So if anybody was to self-isolate in my patch, which is anything south of Shipston and further south, then, you know, we'd just deliver some food bank food so that they're not going hungry. And of course, the NHS boxes have just stopped, I think, or they're just about to stop for the seriously vulnerable. So you may see an uptick in people asking questions about this. I think that's it, really. Thank you.
Thank you, Jo. Really helpful there. Oh, Liz, did you want to come back in?
Yes, thank you, Emily. If I can just, you're quite right, Jo, the government parcels are about to stop at the end of this month, but I should add that the shielding hub is still operating until the 30th of August for emergency deliveries only, but any emergency deliveries that are required, people can ring the 0800 county hotline number, which will go straight through to Hawke's Point, and they can pick up any emergencies at that point.
Brilliant. It's good to know. Thank you, Liz. So final pre-submitted question, and then I'll move on to some that I think have popped up in the chat while we've been talking. So this is a question for Councillor Cabourn and Councillor Falp. Might we have a local lockdown like they saw in Leicester?
I'll take that first. It is unlikely. The object of the whole test and trace exercise, and Warwickshire is in the process. I've signed off today, putting a whole new team together to be recruited to run that, and that's for a 19-month period. You know, we're into this for the long haul. It's not just thinking it'll be gone away tomorrow. So we're putting a team together for that time. We now have access to 7 mobile testing centres. So the plan is that if we find any small outbreak, which is 2, as Emily has said, we'll watch that and see if it grows. And if it starts to grow, we'll move into an area. So our plan is to totally not to lock down. The government has given us some powers yesterday to do local lockdowns, which could be a house or could be various things. We're looking at that because it's not as simple as it might seem. So we're looking at that, but our plan is not to lock down. You know, if we get to lockdown, we'll be really, really serious.
Thank you, Les. It's great to know you've signed off on the additional resource coming into the test and trace system locally. Gratefully received that support. And sorry, Judy, Councillor Falp, did you want to comment on that question as well?
Yes, please. Thanks, Les. Our rates aren't as high, thankfully, as many areas. So at the moment, not likely to have a complete lockdown, but we will get local ones. There will be small outbreaks in certain areas, in possibly schools or workplaces, and we will need to address that. I think the message is, as before, we can't be complacent. there may be another spike. There will be cases still ongoing. We've got to abide by the, you know, wearing masks, socialisation if we need to, and hand washing. You know, it's something we've done all our lives, but constantly have to remind people to do it. So so that we don't get high rates, that we need the message out there that we need to keep being vigilant. And I know there's some questions which hopefully, Emily, you'll pick up about who knows about outbreaks. And I know we've had quite debates at meetings who should know and why we can or can't know. And I'm sure somebody will pick that up in the chat.
Just
Thank
on that, if it helps, Emily, on that, we are now getting from Public Health England down to postcode, which is what we've been waiting for. We'd actually like to get to actually being given a name or a house number. So we're pushing for that, because then if you see one or two random events, as you said, we can start and put them together, and they may be in adjoining streets or maybe same pub, but certainly the pubs and etc. have got to be very conscientious about recording names and numbers. That's why we're doing it. Hairdressers should be, so that again we can record people's travel, and if we have that information when we get a case, we can get out there quick and follow up, because the secret is to following up. And as Judith has said, keep washing your hands and keep 2 meters apart and wear a mask. You know, they're going to be part of life. This has got to be part of life for the next 18 months.
Yeah. Thank you, Les. So key message there around, you know, the lockdown, it's a possibility, see that imposed on us by the Secretary of State across the whole of Warwickshire or a larger area, or we now have those local powers to respond a bit more flexibly, closing down particular venues quite quickly or events, etc. to try and avoid that. But the best thing we can do to avoid that is comply with those prevention measures and with the test and trace system. Joe, did you want to comment as well?
I want to comment, but I also want to I want to follow up on something that Elizabeth asked, which is important to me as well, because I really struggle to wear a mask as an asthmatic as well. And I carry, like Elizabeth, I carry a scarf around with me, but what on earth are those of us who genuinely can't wear one going to do? I know that one of the supermarkets says you have to produce medical evidence. So presumably a prescription to show what you take. I don't know, but there's a bit of a gap there, because not only is it potentially someone who can't actually get a mask on, it's people with breathing conditions that are made considerably worse, or people with panic attacks, or people who've been and I know people who suffered domestic abuse for whom the wearing of a mask will not be a good thing, because it will remind them of incidents that they've had, and I feel very strongly that people shouldn't have to actually disclose to someone at a supermarket what's going on. So I wonder whether you've had any thoughts, Emily, or anybody else on here, as to how that is managed for those who genuinely can't wear them.
Yeah, I mean, it's something we're working through at the moment. There are exemptions from the requirement to wear a mask, and that does include people who have a broad statement medical condition, which means they're unable to wear a mask. So that should cover conditions such as asthma, if you find it very obstructive in terms of your breathing, communication difficulties, people who are deaf or hard of hearing and rely on lip reading, for people with autism, for example. So many of these conditions will be hidden conditions. So I think the request really is for people to be sensitive to that. Don't judge people if you see them in an environment not wearing a mask. There may be a very good but invisible reason for that. We did learn at our last webinar, actually thanks to one of our localities colleagues, that there's a sunflower symbol, a lanyard that you can apply for, which is from Tesco's website, which is a signifier of having a hidden need, which might be something that you could consider, and that's starting to get recognised. So I think there may be other schemes around that people are aware of, and we'd love to know about that, but that's one that we're aware of, and we need to kind of pull together these messages. We're putting some guidance together for businesses around supporting people who would find face masks a communication barrier, and thinking of some alternatives for that. There's a nice, I think it was a YouTube video I saw recently of a paramedic using an app on his phone, so he can wear a face mask, and as he talks the phone brings up the writing. So that was one helpful thing around those communication barriers. Thank you to Amanda, she's just put a link to the Tesco's website for the invisible disability lanyard, so thank you for that. There's a comment that a clear visor could be used. So there's a bit of confusion around visors at the moment. It is a barrier, so it will offer some protection. They're probably a bit more really for kind of protecting transmission into your eyes. So you might see them being used in healthcare settings where aerosols are being produced. So a face covering is a better barrier, but that would offer some protection. Thank you. So I was just going to go back to some of the other questions that have come up in the chat. There's a lot of chat going on, which is great to see, which is a bit tricky to navigate now. So there was one question about collecting workplace details. So that absolutely is part of the contact tracing system as it stands already. So people will be asked if they've been in a workplace so that we can identify those details and communicate with the employer. The question around data. So as Les has said, we're getting a really good level of detail in terms of locations of tests. If we do need to follow up on individual cases or contacts, we can, from Public Health, speak directly to Public Health England, so we can get hold of those details. But routinely, we're now getting those data flows at postcode level. We're just working through the data sharing agreements in terms of what we are allowed to share, but we really want to share ward level data with the public so that you're armed and informed, and we will be doing that as soon as we can. We have published district and borough level data online now, so we alongside our outbreak control plan, so we share that with Coventry, Solihull and Warwickshire. So you can find that at staysafecsw.info. That's staysafecsw.info. And there you'll see the outbreak control plan for our sub-region. And additionally, if you click on the little menu bar at the top, you can have a look at data sources, and there you can see the chart similar to I showed you earlier, but at a district and borough level. So generally, we have had cases have been a bit higher in the north, kind of Nuneaton and Bedworth. Recently, we've seen a little bit of an uptick in cases within Rugby, where they have been very low. We're still now seeing a small number of cases there. Within the south, we have seen kind of, I suppose, average kind of rates, and they are starting to tail off now. We did see some higher rates of hospital admissions within Stratford during the pandemic, largely because it's an older population. So yeah, we're monitoring all of these things, and we're trying to make data available to you publicly as soon as we can. Would just again reiterate the threat is still out there. It's an invisible threat, so we're all vulnerable. All of these prevention measures help to reduce the risk as much as possible, but the risk is never zero, really. So just to remain to stay alert. There was a question around village halls and whether there's guidance around reopening. Oh, sorry, Amanda's provided some guidance around reopening village halls. We would still expect village halls to be undertaking those same risk assessments to ensure that they're opening safely. Sorry, just looking at the questions. Amanda, are there any other questions that I've missed?
So I was making a note of the questions as we've been going along. I think that there was a question from Alan at the beginning with regards to the graph on slide 7 and what the 2 lines stroke bars mean. And then he also asked a question with regards to scams as well.
Okay, so sorry, yes, I didn't really explain the graph. So the the graph had pink bars, which were showing the number of positive cases that were identified on that day, and the blue line just kind of averages it out, so you get a slightly smoother picture of the cases we're seeing, because obviously there's a little bit of delay in terms of when we get the test results back. So there are some kind of I don't want to call it peaks and troughs because there was one big peak, but there's a little bit of variation day by day. So that blue line just gives you a smoother picture of the pattern, really. And what was the question around scams?
The other one was about scams, and obviously the scams in terms of money. It was from a gentleman called Alan, who's actually one of the guests. So it was very early into the webinar, Emily.
Okay, just having
I have tried to sort of indicate by the thumbs up where the questions have actually been asked for you.
Oh, thank you. I can see. So mentioned scams going around asking for money. Alan, do you want to unmute yourself and expand on your question a little bit there?
Yeah, hi. It's there were reports, I haven't experienced this, of people being contacted by track and trace or test and trace teams who would then ask them for money to for the to run the test, to process the test.
Okay.
I mean that I haven't imagined that, and I believe that is a true scam, not a hoax scam, if you know what I mean.
Emily,
so just a warning about that.
Thank you.
Emily, it was a scam, but our trading standards are constantly monitoring all the scams, and we are putting out bulletins every time we see one on the County Council website, because there are one or two about. Every
Thanks,
time we get one, we put it out in public, so we try and help as much as we can.
Yeah, thank you. And just to reiterate, you should absolutely not be having to pay for a test. That's all provided free of charge. Joe, you've got a hand up. Were you looking to come in, or was that an old hand? Okay, thank you. Brilliant. Well, hopefully that's answered all of the questions, and I hope colleagues have found that useful today. There's been a few links to additional information and phone numbers for where people can go for support. So we'll make sure that is all collated, and we will share the slides and a few other resources with you after this webinar. So thank you all for attending today. As I say, it's great to see the level of interest and engagement in this topic. Great to see the amount of support we've had from communities to date during the pandemic. And please just stick with us. We will get on top of this. We are getting on top of it, and we can beat this virus if we all work together.
Thank you, Emily, and thank you all very much.
Thank you.
Yeah.
Thanks all. Bye-bye.
Thanks, everyone. Thank you.
Thank you, everyone.
Right.
Are you saying something, Amanda? Oh no, she's gone. She waved.
Thank you.
Oh, come on. You'd have thought they would have. I'm just on personal video now. How the hell do I come out? No. Every time you do that, you still come up with a one. Those are my emails. I didn't know whether if you deleted that. change that.